Hey guys, Dr. Hagmeyer here. I want to welcome you back to my YouTube channel. Welcome back to part 2 of this video series titled How Supporting the Liver is One of the Keys to Recovering from Thyroid and Hashimoto's Disease. Now, if you're just joining us, in the first part of the video series, I covered the role of the liver and why the liver is so important to thyroid function and Hashimoto's disease. I also spoke about the 7 signs that your liver is tired, toxic, and overworked. In today's video, part 2, we're going to unpack how to best support your liver's detoxification pathways. Some of my favorite herbs that help support the liver and the flow of bile, which, of course, if you remember, helps us get rid of toxins. And then I'll also talk about why 7 and 21 day detoxes, why you'll want to hold off on doing those until you've watched this video. And finally, we'll talk about the 5 thyroid disruptors that you should start eliminating, where you find them, and how, of course, they affect thyroid and immune function. So in order for you to understand how to best support your liver, we first need to gain a little bit better of an appreciation and an understanding of how the liver gets rid of these toxins in the first place. You know, a few weeks ago, I started working with a new patient, and she has a thyroid problem. She has a bunch of hormonal imbalances related to her menstrual cycle. She has cystic acne. She has heavy periods, stomach bloating, and just a really, really bad case of IBS diarrhea. And so she's been to 4 different naturopathic doctors, several different kinds of integrative doctors, each one basically doing the same thing, putting her on hormones and, of course, doing 7 and 14-day detoxes. In a 12-month period of time, her health went from bad to worse, and now she began to deteriorate mentally, right? Just falling apart. Started having all different kinds of symptoms of depression and anxiety and insomnia, waking up in a hot sweat. So again, the reason I tell you all of this is that when it comes to truly supporting your liver, the support needed for liver detoxification is very, very specific, and it needs to be personalized from one person to the next. That's why I say it's not about a 7-day or even a 14-day or 28-day detox, right? To support your liver requires a much, much better understanding of the specific vitamins and minerals and amino acids that are needed by that individual. And so the purpose of that is so you can be very specific and very targeted in the application of supporting those different phase 1 and phase 2 detoxification pathways that we're going to be talking about. Every day we're either coming in contact with thousands of chemicals in the air that we breathe, in the food that we eat, in the water that we drink, and etc. In fact, in 2006, the Center for Disease Control, the CDC, reported that the average American has 116 out of 148 synthetic compounds that they were tested for in their body. There was another study that was done that looked at the umbilical cord blood of newborns, and what they found in that blood of newborns was absolutely shocking. They found things like flame retardant, they found things like jetliner fuel, plastic, PCBs, pesticides, various medications like antidepressants and pain pills that too often get thrown and flushed down the toilet and end up in our water supply. So again, while the study was over 13 years old, it wouldn't surprise me that today the number of those chemicals and pesticides and things like that are even higher, right? So these chemicals that are either lathered on our body from cosmetics and personal hair care products or others that are dumped into the environment from big companies, these toxins can have a profound impact on our liver. And so our detoxification pathways and ultimately the overall expression of our health. So how does the liver, despite all this exposure to toxins, how does it even manage to keep up and keep us healthy, keep us alive? Why are we not all dropping dead, right? That's a good question, right? Well, part of it lies in just how effective the phase 1 and phase 2 or the 2-step enzymatic process is and how efficiently it's running in our body, right? So now I promise you, I'm not going to bore you with all the details, but if you understand this, you'll see why a generic 7-day or 21 detox does very little good long-term for supporting liver health and ultimately thyroid health and autoimmunity. So let's take a quick peek at this illustration here and hit some of the most important points. Now, if you look at this diagram, on the left-hand side, you're going to see just under toxins, it says phase 1. In the first step of detoxification, fat-soluble toxins undergo various chemical changes that are designed to get them ready and convert them from fat-soluble toxins into water-soluble toxins. This is very, very important because water-soluble toxins can easily be eliminated through bile and urine and stool, whereas fat-soluble toxins, if not eliminated properly, will get reabsorbed and then deposited in our fat, making us chronically sick. The important thing I want to share here, and the important thing I want you to see here, is the nutrients that are needed in order for the phase 1 detoxification pathways to work correctly. What I hope you'll notice is that these pathways require various B vitamins, such as B2 and B3 and B6 and B12 and folate and glutathione and various flavonoids to work properly. So any deficiency in these vitamins can potentially affect just how efficient this first phase of detoxification can work. Now, phase 1 toxins are actually very, very toxic. In fact, many free radicals are produced during this phase, and it's critical that these are moved into phase 2 conjugation pathways where they can be excreted. If you look at this diagram just under waste to the left, you're going to notice that it says phase 2, and in parentheses, it says conjugation pathways. In this second stage, these very toxic soluble substances undergo more chemical changes. And it's these chemical changes, right? It's these chemical changes detoxify the substances, making them water soluble so that they can be excreted through the bile, through the stool, or the urine. Again, I want you to pay special note of just how important these vitamins and minerals and amino acids are in this second step of detoxification. Here we see things like folate and magnesium and glutathione and vitamin C and B5 and B12 and amino acids like methionine and cysteine and glycine and taurine and glutamine and choline. These are all needed in order for phase 2 detoxification pathways to work the way they should. So hopefully what you're appreciating now is that in order to support the phase 1 and phase 2 detox pathways, the liver needs to be given vitamins, it needs to be given minerals, it needs to be given these amino acids, and there's no way around this, right? This is why, again, one of the foundational steps to healing thyroid problems, autoimmune diseases, chronic health problems depends on nutritional status. Not diving into a 7 or 21 detox per se, right? It's not as exciting or trendy to talk about vitamins and minerals and amino acids and antioxidants that are needed by the body when there's so much buzz around this detox or that detox. I get it. Those things sell in stores and online websites. But again, testing the areas of cellular health will tell your doctor exactly how to support you foundationally for cellular health. We're all different. We all have different needs. We have different health challenges. We have different stressors, different supplies, and different demands. And without testing, we can't be very specific and targeted to the needs of the liver and other glands and other tissues of the body. So something just to think about. We all have heard about testing for vitamin D levels and B12 levels and calcium levels and iron levels. How come every doctor who works with patients that are chronically ill and chronically sick, why are they not testing for things like amino acids, all the other B vitamins, B1, B2, B3, B6, B9? Why are they not testing minerals and antioxidants and levels of oxidative stress that we know people who have autoimmune diseases and thyroid disease and gut issues are known to be struggling with? You see, you can't simply guess about those requirements, and yet sometimes these are the most overlooked areas that are the biggest pieces of the puzzle. So now that we have a better understanding of some of the specific nutrients that the liver needs in order to carry out proper phase 1 and phase 2 detoxification pathways, let's jump into some of the more generalized support, things that you can do on your own to support liver function. Whenever I think of liver support, I think about specific nutrients that facilitate those phase 1 and phase 2 detoxification pathways. Obviously, we've already talked about that. But from a strategy standpoint, what else can we be doing? What else can we be thinking about? So here are a couple things. Number 1 is improve bile flow. And number 2 is improve GI motility if that's an issue. Number 3 is eliminate the known potential toxins in the foods we eat, the chemicals we use in and around our home, and the things we knowingly put in our bodies. So rule number 1 when it comes to supporting detoxification pathways is we don't want to be detoxifying if we have sluggish motility. So that's rule number 1. So one of the questions I'm often asked about is, should I have my mercury fillings removed before I start working with you? And so the key here is I never, ever, ever recommend having mercury fillings removed without first addressing things like the liver, things like leaky gut, things like gut dysbiosis, and of course, addressing motility issues. From a motility standpoint, we need to have 1 to 2 bowel movements per day. Minimum 1, but I would suggest that you shoot for 2 to 3 bowel movements per day for several months. Number 2, I said improving bile flow, right? So what can we do to improve bile flow? And again, why is that so important? Again, think about bile as one of the main ways the body eliminates toxins, eliminates this toxic hormone overload, right? So again, bile helps the body eliminate toxins. Well, number one that you can do to help improve bile flow is eat more green leafy vegetables, right? Both in salads, but also in making your own juices. If you don't have a juicer, I highly suggest you invest a couple $100 in a good quality juicer. Start juicing things like dandelion greens and kale and mustard greens, turnips, Swiss chard, arugula. And so again, while all those things really don't sound very exciting to put in a juice, don't sound very appetizing, if you throw those veggies in your juicer with 5 or 6 green apples, maybe 1 or 2 different lemons, a thumb size of ginger, you're going to actually find yourself enjoying and looking forward to making them. Right? This is something I do, almost a couple times a week with my own family. Right? I have 4 kids, all of them under the age of 14, and very rarely do I get complaints. Right? So again, the other thing I recommend is something called herbal bitters before meals. So you've probably heard of digestive enzymes. Bitters, unlike digestive enzymes, actually stimulate your body's natural production of digestive enzymes. So these can be great for people who are very sensitive and can't take digestive enzymes right out of the starting gate. This is where bitters really can do a wonderful job, right? Many of the supplements that are designated as herbal bitters, right? You'll want to look for things like this. You want to look for things like gentian, burdock, yellow dock, dandelion root, milk thistle, myrrh, goldenrod. Again, all of these things can help improve bile flow as well as bile production. Another strategy I often think about and implement is something called a binder, right? Now, binders mop up, and as you probably guessed, they attach to toxins and they bind them up. And so again, some of the binders could include things like bentonite clay, activated charcoal, pectin, chitosan, mastic gum, and even everyday things like fiber to some degree, right? For those individuals that have had their gallbladders removed, it's very, very important and almost essential that you support that digestion process by taking some sort of bile support, something that's going to help your body break down fats, break down proteins and starches, and then of course get them to be excreted. So again, using a bile support supplement is very, very important here. And again, I'll leave a link to my website that'll show you some of these different supplements that I use with patients and for those purposes. Okay, so far we talked about the importance of certain vitamins and minerals and amino acids to support phase 1 and phase 2 detoxification pathways. We talked about ways to naturally stimulate bile flow through juicing and the use of bitters. We talked about the importance of supplements that help bind up and mop up these toxins. And we talked about supplements that help eliminate toxins through proper bile flow. The last topic that I want to cover with you today that we want to talk about, of course, are some of the actual toxins lurking in your house, in your food, in your cosmetics, in your beauty products. And again, these toxins are known as thyroid disruptors. And if you're someone who's been diagnosed with an autoimmune disease, again, Hashimoto's disease, Graves' disease, diabetes, lupus, MS, or any of the other autoimmune diseases, this information is going to be very, very important for recovery. Right? The first thyroid disruptor I want to warn you about is something called BPA. BPA is also known as bisphenol A. It's found in plastic containers. It's found in water bottles. It's found in children's toys. It's found in the epoxy lids that, or metal cans that store vegetables and fruits and things like that. And so if you look at this study, here's just one study of many that shows that BPA and the connection between BPA and thyroid disease. So you can see that here. The second thyroid disruptor is something called triclosan, right? Triclosan is found in most of your antibacterial soaps, in toothpaste, in deodorants, hairsprays. And the reason it's problematic is because it has a structure that is very similar to thyroid hormones. And so it actually fools the body, right? The FDA issued its final rule, right? There was, for many, many years, scientists and researchers were talking about the dangers of triclosan. Well, finally, the FDA did its research and finally gave in and basically had a final rule showing that it should be banned. And so you can see that ruling here. The FDA states that triclosan and 20 other active ingredients aren't generally recognized as safe and effective for use in over-the-counter healthcare antiseptic products. One of them, of course, was due to thyroid toxicity. Now, the third thyroid disruptor I want you to be aware of, and I'm going to put these kind of together because they're all chemically very similar, is fluoride, chloride, and bromide. Again, fluoride, chloride, and bromide can be found in our local water supply, toothpaste, mouthwashes, bottled water, teas, canned foods. Bread is often brominated. You'll actually see brominated bread, and even many medications. So while older studies show that fluoride does not affect the thyroid function, new studies continue to pop up showing just the opposite, that it's very, very damaging to the thyroid. Here's one study from 2018 that showed that the higher the fluoride concentration in the drinking water, because that's a major source and exposure to fluoride is our drinking water, the higher the fluoride concentration in drinking water, the higher the TSH level was, meaning the greater the impairment of the thyroid gland. When your TSH levels are very, very high, what's happening is your brain is really trying to stimulate the thyroid into making more thyroid hormones. So again, we know that fluoride elevates TSH levels. Now, the fourth thyroid disruptor I want you to be aware of is actually iodine. And yes, you heard me right. Iodine can cause thyroid problems. Now, there are multiple studies that show iodine can inhibit thyroid hormone release from the thyroid gland. It can also cause goiters. In fact, in individuals who have something called toxic nodular goiters or even Graves' disease or even hyperthyroidism, a treatment called radioactive iodine or RAI is given to kill the thyroid gland and to lower thyroid hormone levels. So it's iodine again. We also know that large doses of iodine will actually decrease blood concentrations of both T4 and T3 thyroid hormone. It can increase TSH levels, right? So do you have elevated TSH levels, but yet you have normal T3 and T4 levels? Something just to think about. Another consequence of iodine is that it can signal thyroid cells to die, right? We call this, this process is called apoptosis. We also have multiple studies that show the impact that iodine can have on an individual who is susceptible to autoimmune thyroiditis or Hashimoto's disease, right, which is the #1 cause of hypothyroidism here in the United States. All right, so be very, very wary of iodine as it relates to thyroid problems for both hyper and hypothyroidism, and especially if you have Hashimoto's. The fifth thyroid disruptor I want you to be aware of that you should start eliminating is aluminum. So where do we find aluminum? Again, aluminum can be found in those deodorants and antiperspirants. It can be found in our cooking pans, especially if you have a non-stick pan that's been around for some time and you can see all the scratch marks in it, right? Those chemicals basically can go back into your body. It's found in medications as well. So those are 5 thyroid disruptors that you should be aware of. And there are many, many others. 2 that come to mind are herbicides and pesticides, one of them being that Roundup, right? We see this chemical glyphosate, right? Glyphosate. Neighbors use it to kill their weeds and feed their lawns, right? We know that that's a problem for people. We also know, besides glyphosate, we also know that atrazine is another problem, all right? We could do almost a whole video on some of these thyroid disruptors, but those are a few just to get you started. So how come you don't hear more about these, right? Unfortunately, many of these toxic chemicals are made by the big pharmaceutical companies who have just an infinite amount of political influence. They have tons of money. They have lobbyists in Washington and powers to publish studies that claim that these chemicals are safe. So the best thing you can do as a consumer, and when it comes to these hormones and these thyroid disruptors, is be your own health advocate. Be smart. Use common sense. Read labels. Look at ingredients. Start minimizing the chemicals that you use in and around your house. The ones that you put on your skin. Opt for natural methods of weed and pest control and natural methods of cosmetics and deodorants. Every little bit is going to count. Everything you do ultimately will help you, help your family, help the environment. And so if you think toxic exposure is playing a role in your autoimmune problem, also I want you to be aware of that there's some very specialized testing that we offer and doctors who practice functional medicine offer through their offices that can evaluate and look at the role that these chemicals and the relationship that's going on between your immune system and these exposures to these chemicals. Some of these toxins and this toxicity may be one of the pieces of your health puzzle in terms of why you're not overcoming your illness or your disease. All right, and I talk about these frequently. So there you go. Hope you enjoyed part 2 of this video series on the importance of liver function, how it relates to thyroid disease and autoimmunity. If you like today's video, leave me a comment below, and remember, when it comes to tackling the root cause of poor thyroid function and autoimmunity, your doctor needs to be a good investigator. The more clues that he has about what's wrong inside your body, or she has, the more clues they have about what's going on inside your body, the easier it's going to be to understand where your body needs help and where your body can best benefit from support in the years to come. If you need help getting to the root cause of why your thyroid is failing or why you're struggling with an autoimmune disease, visit my website. Hit the Start Here button. There's a questionnaire there that you can complete, and once we know a little bit more about your health concerns and your goals, within about 10 to 15 minutes, we'll send you out an email with some recommendations on how to get started and how we can help you. Whether that's working with you to improve your diet or digging deeper and going beyond just diet and digging into things like the triggers of autoimmunity and the various tests that we offer, we're here to help you. Okay, so until next time, take care.